Have you ever noticed a tiny spot on your arm or a new freckle on your face and just thought, oh, it's nothing, just another sign of getting older, or perhaps a little patch of dry skin that just won't go away? No matter how much lotion you apply, it's so easy to dismiss these small changes, isn't it? We look at our skin every day, but sometimes what we see, or more accurately, what we don't see in terms of change, can be one of the most important messages our body is trying to send us. The painful reality is that our skin, a living canvas of our life's journey, can sometimes develop subtle, often overlooked marks that are whispering a secret that, if heard early enough, could make all the difference. Many of us, especially as we've enjoyed years of sunshine and outdoor living, might carry these silent messengers without even realizing their true significance. They're not always painful, they don't always itch, and they certainly don't always look alarming at first glance, which is why they often go unnoticed for far too long. In this video, we're going to gently peel back the layers and truly look at what your skin might be trying to tell you, focusing on the often missed signs that could indicate something much more serious. We'll explore why these seemingly harmless spots deserve your attention and what you can do about them. Watch to the end for something that will truly surprise you about how much control you actually have over this often feared aspect of health. Let's dive right into what your skin might be trying to tell you, starting with some of the most common, yet often misunderstood, silent signs. Imagine, if you will, a tiny, seemingly innocent bump. Perhaps it's on your nose, or the back of your hand, or even on your chest. It might be pearly and waxy, almost translucent, sometimes with a little indentation in the middle, or perhaps a tiny visible blood vessel snaking across its surface. You might initially mistake it for a stubborn pimple that just won't clear up, or a small, shiny scar. That's often how basal cell carcinoma, or BCC, presents itself. It's the most common type of skin cancer, and while it rarely spreads to other parts of the body, it can grow deep into the skin, causing damage to surrounding tissue if left untreated. Many people will tell me they've had a spot like this for months, or even years, thinking it's just a persistent blemish. But the key here is its persistence and its peculiar appearance. It might bleed easily, then scab over, only to reappear. It could also look like a flat, firm, pale or yellow area, resembling a scar, or even a reddish patch that looks a bit like eczema, especially on your chest or back. This is why it's so tricky. It doesn't always scream cancer. It often whispers, quietly, subtly changing over time. Think about how many times you've had a pimple that just never really went away, or that kept recurring in the same spot. If you have a spot that fits this description, that's been there for more than a few weeks and isn't responding to typical skincare, it's definitely something to have checked out. It's like a quiet little alarm bell, ringing softly in the background. Now, moving beyond that pearly bump, let's consider another common culprit, often found in areas that have seen a lot of sun over the years, like your face, ears, lips, or the backs of your hands. This particular silent sign can appear as a firm, red nodule, sometimes tender to the touch, or it might show up as a flat lesion with a scaly, crusted surface. This is often how squamous cell carcinoma, or SCC, makes its presence known. Unlike the basal cell, which is more of a quiet whisper, squamous cell can sometimes be a bit more assertive, though still easily dismissed. It might look like a persistent sore that doesn't heal, or one that heals and then reopens. Imagine a patch of skin that feels rough and scaly, almost like sandpaper, and no matter how much moisturizer you put on it, it just stays that way, perhaps even getting crusty or bleeding. Some people might mistake it for a persistent wart, a simple rough patch from sun damage, or just chronic dry skin. But the telltale sign here is its relentless nature, and often its progression from a rough patch to a raised bump or a non-healing sore. This type of cancer has a slightly higher risk of spreading than basal cell. though it's still highly treatable when caught early. So, if you have a spot that's persistently red, scaly, or seems to be growing and doesn't heal within a few weeks, especially if it's in a sun-exposed area, it's a critical sign not to ignore. These are not just cosmetic issues. They are your body giving you a direct message, and paying attention can make all the difference. These silent signs aren't there to scare you, but to empower you with knowledge. But our skin tells many stories, and there's another chapter we need to explore, one that often causes the most concern because of its potentially aggressive nature if not detected early. This is melanoma, and it's the type of skin cancer you hear about most often in a serious context. However, it's crucial to understand that while it can be dangerous, early detection dramatically improves outcomes, which is why paying close attention to its signs is so vital. Melanoma often starts in an existing mole or appears as a new dark spot on your skin. What makes it tricky is that many of us have moles, and most moles are perfectly harmless. So, how do you tell the difference? We use a simple, memorable guide called the ABCDEs of melanoma. Think of it as your personal skin detective kit. First, A stands for asymmetry. Imagine drawing a line through the middle of a mole. If both halves don't match, it's asymmetrical, and that's a red flag. Most normal moles are symmetrical. They look pretty much the same on both sides. But if one side looks different from the other, it's trying to tell you something. Next. B is for border. A normal mole usually has smooth, even borders. But if the borders of your mole are irregular, ragged, notched, or blurred, that's a concern. Think of it not as a neat circle, but more like an amoeba with an uneven edge. This unevenness signals a need for a closer look. Then comes C for color. A healthy mole is usually a single shade of brown or tan. However, if a mole has varying shades of brown, tan, and black, or if it has patches of red, white, or blue, that's a significant warning sign. Melanoma often presents with multiple colors or an unusual mix of shades within the same lesion. It's not just a uniform brown anymore. D is for diameter. Generally, if a mole is larger than 6 millimeters, which is roughly the size of a pencil eraser, it should be examined by a doctor. Of course, some normal moles can be larger, and some melanomas can be smaller. But this is a good general guideline to keep in mind. Think of it as a quick visual check. Is this spot bigger than the eraser on your pencil? Finally, and perhaps most importantly, is E for evolving. This refers to any change in the mole's size, shape, color, elevation, or any new symptoms such as bleeding, itching, or crusting. If a mole is evolving, it means it's changing over time. This is arguably the most crucial sign because it highlights that your skin isn't static. It's actively changing in a concerning way. Perhaps it felt smooth before, and now it's raised, or it used to be one color, and now it's darker or has multiple colors. Any mole that is new or changing, especially after the age of 50, warrants immediate attention. Beyond these ABCDEs for moles, there are other less common but equally important silent signs your skin might show. A non-healing sore that simply refuses to close up, bleeds intermittently, or scabs over repeatedly without fully healing. This could be anywhere on your body, even in areas not exposed to the sun, and it's a critical signal. Or consider a persistent, scaly patch that might be red or brown, but doesn't itch or bother you much, and just never goes away. These can often be precancerous growths called actinic keratoses, which have the potential to turn into squamous cell carcinoma over time, especially on the face, scalp, or hands. And, sometimes, it's just a new growth that doesn't fit neatly into any category. But it's new, it's persistent, and it just feels off to you. Trust your intuition. If something on your skin looks or feels out of the ordinary, or it just doesn't seem right to you, That feeling is valid and deserves attention. The key message here is vigilance and an ongoing conversation with your skin. You are your own best advocate, and recognizing these subtle messages is the first, most powerful step you can take. So, we've talked about those subtle, often silent signs your skin might be showing: the waxy, pearly bumps of basal cell carcinoma, the scaly, non-healing patches of squamous cell carcinoma, and the more concerning, but clearly identifiable, ABCDEs of melanoma. It might feel like a lot to remember, but the core message is simpler than you think. Pay attention to your skin. This isn't about becoming fearful every time you see a new freckle. It's about becoming aware, informed, and proactive. The power in recognizing these signs isn't just about identifying a problem. It's about the incredibly positive outcome that comes from early detection. And here's that surprising truth I mentioned earlier: when caught early, skin cancers, even melanoma, are often highly treatable. The survival rate for melanoma, when detected early and localized to the skin, is incredibly high, well over 90%. That's a statistic that should bring immense reassurance, not fear. It means that simply being vigilant and acting quickly on a suspicious sign can truly be life-saving. Think about it. You don't need fancy equipment or a medical degree to notice changes on your own skin. All it takes is a monthly self-check. Stand in front of a mirror, ideally a full-length one, in good light. Look at your entire body, front and back, arms and legs, paying close attention to areas that get a lot of sun exposure, but also checking less obvious spots like your scalp, between your fingers and toes, the soles of your feet, and even your fingernails and toenails. Use a hand mirror for those hard-to-see areas like your back. And if you have a partner or a trusted family member, ask them to help you check your back and scalp, documenting your moles, perhaps by taking photos every few months. Can also be a really helpful way to track changes over time. It's a simple routine, takes just a few minutes, and is one of the most powerful steps you can take for your long-term health. It's about empowering yourself with knowledge and simple habits. Remember, our skin tells the story of our lives, from sun-kissed days to every laugh line. It's a testament to the journey we've been on. And just like we get our eyes checked, or our heart checked, our skin deserves the same attention and care. Don't dismiss those little whispers. If you notice any of the signs we've discussed today, a non-healing sore, a new mole, or a mole that's changing, a pearly bump, or a scaly patch that just won't go away, don't hesitate. Pick up the phone and make an appointment with your doctor or a dermatologist. They are the experts who can properly assess what you're seeing and provide you with peace of mind, or the necessary treatment if something needs attention. Taking action when you notice something is not a sign of worry. It's a sign of wisdom, self-care, and a deep commitment to living your best life. We truly hope this conversation has given you some valuable insights and, more importantly, a renewed sense of confidence in being your own health advocate. Have you ever noticed a suspicious spot and had it checked out? What was your experience? Sharing your stories in the comments below can be incredibly helpful and encouraging for others in our community. We learn so much from each other. If you found this video helpful, please give it a thumbs up. It helps more people find this important information. And if you haven't already, consider subscribing to our channel for more practical tips and reassuring advice on living your healthiest, happiest life at every age. Thank you for spending this time with us. Live your best life at every age, confidently and with peace of mind.